Finding yourself constantly searching for the nearest bathroom. If you're out shopping, to the grocery store, going out, and then you suddenly feel that urge to urinate that is forcing you to stop everything you're doing. You're like, I have to go right now. If this is happening to you, you're not alone. This affects millions of men and women around the world every day. And today I'm going to explain to you why is it actually happening, and most importantly, what you can do about it. I'm Dr. Peter Aziz. I'm a board-certified urogynecologist and pelvic surgeon. Today we're going to talk about overactive bladder. So what is that, OAB, or overactive bladder? It's a group of symptoms. It's not a disease in itself. It's rather a syndrome that affects your bladder functions. The most important symptom or something that is associated with that is urgency. What does that mean? That sudden feeling that you have to urinate right away. You cannot postpone it. You're watching TV, you're gonna pause it, you're gonna go to the bathroom. You're eating your meal, you're eating a sandwich, you're gonna put the sandwich down and you're gonna go to the bathroom right away. This affects both men and women, although it's more common in women. In fact, studies show that approximately 40% of women in the United States experience overactive bladder in their lifetime. These numbers increase with age, unfortunately. Though I want to be clear though, it is not a normal part of aging to have an overactive bladder. It is a medical problem that can affect your quality of life and can be addressed at the same time. So the impact of overactive bladder goes beyond the symptoms that you feel, because many people who have overactive bladder, they have reduced quality of life. They avoid social situations. They don't want to go out. They wake up multiple times in the middle of the night to urinate. They often feel anxious about being away from a bathroom, and they try to plan their lives to make sure that there is a bathroom around. So it actually takes a big toll on your mental health. So let's talk about the symptoms. We have 4 main symptoms. Let's explain each one of them. Number 1, like we discussed, is urgency. This is the most important and hallmark symptom. That sudden, strong urge to urinate that you cannot defer. You feel like if you don't get to the bathroom, you might have an accident and start leaking. And this urgency can happen out of nowhere. You might be fine and then all of a sudden you're like, oh my God, I gotta go right now. Number 2 is frequency. What does that mean? That means you're going to the bathroom more than normal. Okay, so what is normal? Normal means 8 times during the day or while you're awake, and up to once at night. So if you're going up to 8 times, you're still okay. More than that, that is abnormal. Same thing at night, which is the 3rd symptom. There's something called nocturia, which is waking up at night to urinate. If you get up once, that's okay. If you get up more than once, that's not okay. And it can actually affect your sleep quality, because a lot of times people cannot go back to sleep because they've been up multiple times at night to urinate. So in the morning, you feel tired because you didn't get enough sleep. You can't focus on your studies or on your work. And lastly, something called urge incontinence. What does that mean? Incontinence means leakage of urine. However, this is leakage of urine that is preceded by a strong urge, meaning that you feel like you have to pee. It's a strong urge. You do not make it to the bathroom and you start dribbling a little bit before you get there. Especially like during those last moments where you're trying to take your pants off and then you start feeling those drops coming down. One important distinction, if you leak with coughing, sneezing, laughing, exercise, that's a different type of incontinence. It is not related to overactive bladder and it's a completely different treatment. I do not want you to be confused. Okay, so why does overactive bladder happen? It's important to understand how the normal bladder works. The bladder is a muscle. It's called the detrusor muscle. As it fills with urine, it stays relaxed. Until it's time to urinate, the brain sends a signal, and then the muscle starts contracting. So the little muscle that is closing the urethra relaxes, and then urine starts flowing out. Sounds pretty simple. However, with overactive bladder, the muscle starts contracting on its own. So pretty much the bladder is too excited. It doesn't have to be a full bladder. Sometimes your bladder is not even halfway full, and then it starts contracting, and then you feel like, oh, this is when you have to go. There are some numerous factors that can contribute to overactive bladder. Sometimes like nerve conditions that can disrupt the communication between the bladder and the brain and the spine, like Parkinson's disease, multiple sclerosis, stroke, spinal cord injuries. If there is a bladder obstruction, particularly in men with enlarged prostates or women who had previous incontinence surgeries, this can lead to bladder muscle changes that result in overactivity. Other things like infections, stones, tumors can irritate the bladder and can trigger symptoms that mimic overactive bladder. Also, hormonal changes, especially in women, when estrogen decline, that occurs with menopause, this can affect bladder tissue and bladder function. There are certain medications that cause you to go a lot, like diuretics, for example. That's medication that you take for high blood pressure. It stimulates your kidney to release more urine, so you go more frequently. Keep in mind, overactive bladder should not be dismissed as just getting older. No, it can be diagnosed, and there are treatments available. So how do you diagnose it? It's not difficult at all. It's very simple. History and physical examination. You talk to your doctor. They're going to ask you about your symptoms. When did it start? How often do you urinate? How many times do you get up in the middle of the night? Are you leaking before you get to the bathroom? Anything makes it better or worse? A bladder diary is very, very important. So try to keep a record of 3 days. Document every time you urinate. How strong was your urgency? And if you leaked urine before you get to the bathroom or no. This gives objective data about your patterns and help confirm the diagnosis. You might also get a urine analysis or urine culture to make sure you do not have a bladder infection. And sometimes your doctor want to make sure that you empty your bladder well, so they might do a quick ultrasound or use a tiny catheter. Once the diagnosis is confirmed, then your doctor is going to talk to you about treatment options. There are a lot of different kinds. Usually we start with things that are safe, low risk, conservative, like behavioral modifications. That includes bladder training. What does that mean? It means that you gradually increase the time between bathroom visits. I usually tell patients, try to urinate every 2 to 3 hours. Not less, not more. Don't wait too long, but also don't try to go every hour because you're worried about the bathroom. This basically is retraining your bladder to hold more urine. Diet can actually affect your bladder significantly. Some things like caffeine or alcohol, artificial sweeteners, carbonated beverages, acidic food, spicy food, all of these things can irritate the bladder. So reducing them can make you go less frequent. Also, try to restrict fluids a little bit. Do not dehydrate yourself. However, let's say someone has a problem where they get up 5 times in the middle of the night to urinate. Try to cut back drinking about 3 hours before you go to sleep. When you do that, you're going to start noticing improvement. When you go to bed, you're not waking up as much. Same thing during the day. Don't drink like big glasses of water at once. Try to spread out your water intake throughout the day evenly. Another treatment that actually works well and it's not often prescribed or discussed is pelvic floor physical therapy. That's where you work with a specialized physical therapist to teach you exercises to strengthen the pelvic floor muscles and techniques that you can use when you have the urgency. Those are just not your regular Kegels. This is actually comprehensive training of your muscles to control your bladder functions. And we have very good studies that show that physical therapy is extremely effective in reducing incontinence and overactive bladder symptoms. So what if all of this fails? Then we can talk about other treatments. There are some medications that you can take. These medications work by relaxing the muscle of the bladder, so you don't feel like you have to go all the time, and they actually make you hold it for a little bit longer. But of course, medications, like anything else in medicine, there could be side effects. These side effects can be dry eyes, dry mouth, a little bit of constipation, sometimes dizziness, sometimes blurred vision. Certain kinds of medications called anticholinergics that are actually not very recommended for patients over the age of 60 because there is a concern about early onset dementia and cognitive impairment in patients over 60 with long-term use. So we'll monitor those patients very carefully. If medications failed, then there are other advanced treatment options. Some minimally invasive procedures that we can do, like injecting Botox in the bladder or doing nerve stimulation to basically stimulate the nerve in the sacrum that controls the bladder functions. They work really well. They're usually covered by insurance, and we have very good success with them. Just make sure you talk to your doctor, get a referral to a urologist or a urogynecologist who specializes in treating overactive bladder. And the provider will basically assess your condition and offer you treatment based on your individual scenario. So a few more things I want to add or emphasize. Number one, weight loss. If you are overweight, losing even 5 to 10% of your body weight can significantly improve your overactive bladder symptoms. Also, smoking. Smoking can irritate the bladder significantly, especially if you're coughing a lot, stresses the bladder. If you smoke, this can benefit your bladder and overall health. Also, it decreases your risk of having bladder cancer. Make sure your chronic conditions are well controlled, like diabetes, because if your diabetes is not well controlled, you're going to notice that you're going to the bathroom more frequently, drinking more frequently. Just remember, don't suffer in silence. It's a very, very common condition, but a lot of times people are embarrassed to discuss it with their provider. So if you have this, just talk to your doctor, and I am sure they're going to provide you with the right guidance and treatment. If you found this helpful, please subscribe to my channel, give this a thumbs up, and share this with someone who might be suffering from the same problems. Drop a comment below if there's any topics that you want me to cover. I read them all and I try to respond as much as possible. Remember, your health matters. Take care of yourself. I'll see you in the next video.